Hello everyone, myself Dr. Drishti Jha. Welcome to the Microbiology Masterclass by Dentospedia. Dentospedia is one of the trusted platform for dental board examination preparation. So from today, we will be starting a mini series of microbiology subject where I will be explaining to you the important topics of microbiology in a very brief way. So let's start with our first topic, that is gram-positive and gram-negative bacteria. Bacteria are classified into gram-positive and gram-negative based on the cell wall structure seen in the gram staining. So we do a procedure which is known as gram staining. This is very important diagram in which the gram-positive bacteria stains purple and gram-negative bacteria stains red or pink. Okay. This is a gram staining. You have to remember what we do. We do gram staining, MCQ question, and what are the color of different types of bacteria. Gram positive stains purple and gram negative stains red or pink. Now, gram-positive bacteria have a thick peptidoglycan layer, retains crystal violet, and appears purple. This is the final color, okay? This you have to remember. Thick peptidoglycan also you have to remember. They contain the teichoic acid, which aids in the adhesion of tooth surface of the bacteria to the tooth surface and contribute to the dental plaque and biofilm formation. This is very important, the function of the teichoic acid. Important dental examples includes the streptococcus mutans, that is for the dental caries, and actinomyces israeli, that is for the actinomycosis. Okay, these are the properties of the gram-positive bacteria you have to remember. Now, the gram-negative bacteria have a thin peptidoglycan. Earlier in gram-positive, you have seen thick peptidoglycan, but here this is the thin peptidoglycan, but one extra layer is there, that is an outer membrane with the lipopolysaccharide substance, that is LPS, an endotoxin which is responsible for inflammation and tissue damage. This is the endotoxin. Which is the endotoxin? That is the lipopolysaccharide. They appear pink and red after counter staining, that is the gram staining, and are generally more resistant to the penicillin due to the outer membrane. This endotoxin is the characteristic feature of gram-negative bacteria. They are responsible for the tissue damage, inflammation, and also resistance of the bacteria to different types of antibiotics. Sorry, they are because of the endotoxin. So this is one of the most important factor for gram-negative bacteria. In dentistry, gram-negative anaerobes like Porphyromonas gingivalis and Tryptonema denticola are the major pathogen in chronic periodontitis, especially in the deep gingival pockets. Okay, these are the important examples in our dentistry. Now, this is just an diagrammatic representation so that you can remember the points in a very better way. This is the gram-positive bacteria. Okay, this is having the teichoic acid. Okay, and the peptidoglycan, you can see the thick peptidoglycan and periplasmic space, that is the space between the plasma membrane and the peptidoglycan is known as periplasmic space, and these are the integral proteins of the bacteria. And in the gram-negative bacteria, you can see the outer membrane, that is a lipopolysaccharides, that is the endotoxin, which is the characteristic feature of the gram-negative bacteria, which is responsible for the tissue damage, inflammation, and also the resistance to different types of antibiotics. And also they are having the thin peptidoglycan. Okay. And here also there is a periplasmic space and their plasma membrane and integral protein. Now this is just an table to help you remember the important points. Peptidoglycan, thick is there, here it is thin. Outer membrane absent, here present, that is the liposaccharides, polysaccharides, and which is known as endotoxin, the characteristic feature of gram-negative bacteria. Teichoic acid, it is present, is it absent here? Stain color, this is also important, it is purple, and here it is pink or red. Sensitive to penicillin, more sensitive, it is less sensitive due to outer membrane. This is responsible for resistance to different types of antibiotics. Examples, streptococcus, staphylococcus, and here you can see the E. coli, Neisseria, and Porphyromonas gingivalis. Now, mnemonic to remember the gram-positive and negative bacteria. Mnemonic, negative like not thick, not purple, nasty, endotoxin. You can remember as this. Gram-negative having the thin wall, thin peptidoglycan, pink stain, pink or red stain is there. Outer membrane with LPS, that is toxic, that is endotoxin is there. okay, and no teichoic acid is present. Mnemonic positive is pretty purple and thick, okay. So gram positive having the purple stain, thick peptidoglycan is there, teichoic acid is there, no outer membrane is present. Now, clinical link, okay? So, gram-negative anaerobes. Anaerobes is that the organisms which thrive in absence of oxygen. Absence of oxygen. And aerobes is that which need oxygen for their survival, okay? Are the red complex in the gums, okay? So, in periodontist, you will be learning about the red complex, yellow complex, purple complex. In the red complex, there are some three basic organism, okay? That is Porphyra gingivalis, Treponema, denticola, okay? And also one organism also there, that is, so the third organism of this is, first is a P. gingivalis, Triptonema denticola, and Tannerella forsythia. These are organism and these are the gram-negative bacteria. So the question can be framed as the organism in the red complex is what? Gram positive or gram negative? Then your answer will be gram negative anaerobes. And also remember anaerobes, okay? Because they thrive in absence of oxygen. Teichoic acid helps gram-positive bacteria adhere to the mucosa relevant for dental plaque formation. So in the dental plaque formation in the periodontist, this is periodontics. This is a one important step, that is the formation of the biofilm and aggregation of the bacteria. So basically, teichoic acid helps the bacteria to adhere to the tooth surface. Thank you so much for watching. I hope you liked the video. So for a more detailed video of microbiology chapters, you need to download our app, that is Dentospedia, where you will be getting every subject in a very structured and curated form, where you will be having the video lectures, quizzes, notes, and mock test that will ace your preparation for your dental board examination. So thank you so much and happy learning.